So, good evening, everyone. I'm Dr. Shailesh Gupta, laparoscopic, bariatric, and robotic surgeon from Max Papadganj and Vaishali, Delhi NCR. So, today in the series of Mastering Billion Seviston page by page, I'm going to give a lecture on day case surgery. Just remember that it is also known as day care surgery. So, day case surgery and day care surgery are synonyms. In the Bailey, it is mentioned as day case surgery. So, I have named the lecture by the day case surgery. This is a very important topic, very common, only asked as a short note in your exam, and an interesting topic also. So this will be the flow of the lecture. We're going to have some MCQs, and the purpose of is to know your awareness, and the answer will be there in the text. And at the end of it, I'm going to give the answer formally. So what we're going to study today? We're going to study about definition, introduction for various type of duration type of surgeries. Like there are certain surgery which are defined by the duration of the admission, time between admission and the discharges. So we're going to discuss about them. I'm going to discuss about model of cares. There are multiple model of cares in the day case surgery. What are the selection criteria? What are the criteria to choose the patient who can undergo daycare surgery? We're going to discuss about the perioperative management in daycare surgery. We will discuss about elective and emergency daycare surgery. And in the last, very important, the discharge process, which are criteria in day case or daycare surgery. To start with, I'm going to start the first topic. I'm going to discuss few definition, right? This is a pre-test. So what is the definition of daycare surgery? Admission and discharge within 24 hours, admission and discharge within 12-hour working day, admission and discharge within 48 hours, admission and discharge within 72 hours. Question number 2, which term refer to surgery where the patient is not admitted to a ward facility? Basically, उस सर्जरी को क्या बोला जाता है जहां पे पेशेंट को हम वार्ड के अंदर एडमिट नहीं कर रहे हैं? Outpatient surgery, procedure room surgery, day or same day surgery, none of the above. If you A and B are quite similar, but the Bailey gives the exact answer of this. So the purpose of MCQs is to take the pick the high points and discuss them so that we can retain them. So these are the few definition. Just remember that outpatient surgery is defined as in which patient is not admitted to a ward facility, right? Patient doesn't enter into a ward. This is outpatient surgery. Basically, there are two things. One is IPD, one is OPD. So patient is not entering into the IPD. It is managing only in the OPD, right? The other term known as procedure room surgery. Surgery which doesn't require a full sterile theater facilities are known as procedure room surgery. Day or same day surgery or day case or day care surgery, the topic which we are discussing, is defined as when the admission and discharge are done within the 12-hour working day, then it is known as day case or day care surgery. Overnight stay surgery, 23-hour admission with early morning discharge, right? There is also term known as short stay surgery, in which admission up to 72 hours is there. So this is how the Bailey basically define the various kind of the surgery according to the time frame between the admission and the discharge. So this is very important. These are all can be asked as MCQs, right? So this is very important slide. Just remember that. So now the topic of today is day case surgery. Again, I'm saying as day case and day care are synonyms, but Bailey mentioned as a day case surgery. So I have mentioned the topic as a day case surgery. So day case surgery के अंदर क्या हो रहा है? Admission और discharge के अंदर 12 आवर का टाइम है और working day में कर रहे हैं. So this is done in the daylight, in a working day span, right? So within that 12-hour working day के अंदर admission भी हो गया, procedure भी हो गया, patient discharge भी हो गया. So there is no overnight stay in this. So just remember that day case surgery is a patient pathway. It is a process, not a procedure, and extends from the first patient contact to the final discharge. So this figure I have taken from the Bailey, and it tells us about the day case surgery pathway. Just remember that this is the basically UK pathway. So the UK, there are various GP which send the patient to the specialist for consultation. When it reaches the specialist, Then after reaching to the specialist do the diagnosis and optimization, right? So when the diagnosis and optimization is done, we make a diagnosis and then we send the patient for a preoperative assessment. This preoperative assessment is done by the anesthetist, right? So now we have diagnosed the patient, we have done the preoperative assessment. Now we need to schedule the admission, right? So this is where the day case surgery begins. So patient get admitted on the same day surgery is happening, and patient get recovered and the surgery and the patient discharged. So basically this pathway is basically of day care surgery. This is day case or care surgery. And if somehow patient has pain, patient didn't tolerate liquid, if somehow this unplanned overnight admission, in that case, it is overnight stay, right? This is overnight stay. So just remember that in any day case surgery, there could be a overnight extended stay. Then it doesn't remain a day case surgery, it get converted to a overnight stay surgery. So this is the elective day surgery pathway, which is commonly followed in the UK. Just remember that Love and Bailey is basically a UK book and Sebastian is basically a US book. So a lot of things in the Love and Bailey, you're going to remember, you're going to read more about the UK pathway. So now prerequisites क्या है कि इम्पोर्टेंट चीज क्या है डे केयर सर्जरी के लिए, क्या चीज होनी चाहिए तभी हम डे केयर सर्जरी कर सकते हैं. नंबर 1, patient should be informed and fit for the procedure. Patient should know that he will be undergoing surgery and discharge the same day, and he should be fit. Number 2, we should understand that the procedure we are choosing for the patient should be achievable as a day case, right? Like you can't do a gastrectomy, you can't do a colorectal resection for a day case surgery. Your procedure should be ideal so that patient can be discharged the same day. Number 3, आपको अपना प्रोसीजर अर्ली मॉर्निंग या मॉर्निंग में आपको लिस्ट करना है सो दैट यू हैव इनफ टाइम फॉर अ सेफ रिकवरी एंड डिस्चार्ज. Number 4, home environment that can support a post-operative ambulatory patient, so that you should remember that you should also have a knowledge about the patient home support. Ultimately, patient will going back to the home on the same day, so there should be enough ambulatory support at the home which can sustain this model, right? So what is the advantage क्या है हमारी डे केयर सर्जरी के अंदर? Number 1, less disruption to the patient domestic and social situation. Basically, patient once he reaches the home, he feel more comfortable psychologically and physically. So overall, his routine is not disturbed so much. Number 2, obviously, it is a financial saving to the patient, to the hospital, right? Hospital के resources, nursing resources, pharmacy, consumables, and obviously bed is getting saved. So there is a financial saving to the patient. So in the resource-rich countries like developed country, day care surgery is an integral component, because one of the reason is here the patients are well informed, are well counseled, and they have a better home support. So overall, the system in the developed country is quite ideal for daycare surgery. But now in the developing countries like India and other countries, this daycare surgery concept is picking up fast. So guys, the answer is, what is the definition of day surgery? Admission and discharge within the 12-hour working day. Question number 2 का answer है outpatient surgery. Patient is not admitted to a what facility. Moving on to abhi we discuss about the various definition, right? The advantages of the daycare surgery, what were the prerequisites for daycare surgery. Now the most important thing is, now we need to discuss about the model of care. So in the daycare surgery, there are different kind of models, right? There are different kind of system which can deliver a daycare surgery, right? They are clearly mentioned in the Bailey, and they are little confusing. So I will try to simplify them and present to you in a more objective manner. Model of care means healthcare system के काफी types हैं जो day case surgery को produce कर सकते हैं. So we're going to discuss about those models. Basically, these are type of infrastructures.